Now with a report on services available for new mothers. Here's our reporter, Laura Windsor.
The Bridges for Newborns program offered at St. Jude Medical Center in Fullerton gives assistance to new mothers by providing them with various resources to help them care for their newborn. Here to discuss the program is registered nurse Fran Buche.
The Bridges for Newborns program is a network of hospitals and community agencies throughout Orange County that work together with the Children and Families Commission of Orange County to make sure that all the children born here get off to a healthy start. The program here at St. Jude starts before the baby's born. We offer a full range of prenatal classes. So we have childbirth classes, parenting classes, siblings, grandparents class, dad's class, and tours of the hospital, so people get as much information as they want to have before they have the baby. We have the Mother Baby Boutique, which is a shop we have that can supply all the needs that a new mom may have for her baby and herself, for that matter. We have books, clothing, breastfeeding supplies, and even breast pump rentals there also. Once the baby's born, the Bridges for Newborns program starts right at the bedside in the hospital, where we have nurses who specialize in breastfeeding come and visit every mom and make sure that the breastfeeding experience is getting off to a good start. And then before the mom and baby go home from the hospital, an appointment is scheduled for them at our Mother Baby Wellness Center. And the Wellness Center is staffed by registered nurses. The mom and the baby spend about 45 minutes with them, where the nurse will do a medical exam to make sure everything's okay with the mom and the baby from that respect. If they do find any issues, they call their physician and make sure that those are taken care of. They answer all the questions that the new mom or family members may have about what's going on in their family or about the baby. If the nurse recognizes that there's needs that the families may have, she connects them either with resources here at St. Jude or in the community. That might be like health insurance for the baby, a medical home. Some families don't have enough food in their home, or their home is unsafe, so those would all be things that would be taken care of by the nurse. Also, during that time, it may be found that the family's eligible for our home visitation program, and that is another part of the Bridges for Newborns program that we offer here at St. Jude, where the families are followed for 1 year and their individual needs are met during that time, so that by the time the baby's a year old, they're off to a good start and everything's taken care of for them. Any children born in Orange County qualify for the program. When the family's ready to leave their visit at the Mother Baby Wellness Center, the staff makes sure that they have the telephone number for the Wellness Center so they can call with their questions and concerns. We also make sure they have the telephone number for their physician and the St. Jude Nurse Advice Line. These are just great sources of support and information for them in the next few days and weeks as they go through all the changes of having a new family. One other thing, as the Bridges for Newborns program continues after you have the baby, we offer breastfeeding workshops twice a week for moms, private breastfeeding consultations with nurses. We have infant massage classes and the infant child CPR classes. It's been very rewarding to see that, to have them even come back and tell us, we're so glad you're here. You know, we call you when we need to, but we know you're there when we need you, or when we don't need you, we tell our friends about you. So that's been a really exciting part of it for me.
Having more information and resources available can give new mothers more confidence. I'm Laura Windsor for the American Health Journal.